Hi, so today we are going to be discussing HLA subtypes and diseases. HLA refers to the genetic region on chromosome 6 that codes for your MHC molecules, right? And different individuals have different HLA alleles, and these alleles determine the specific type of MHC molecules that they express. So, interestingly, certain HLA alleles, right, they are associated with an increased risk of specific diseases. But however, it is very important to note that these associations increase the risk, right? But they do not guarantee the disease. So first of all, I want to explain what I meant by alleles. So the most easiest way to explain this is that all of us have an eye color, right? But all of us have a different eye color. So someone can have blue, someone can have black, someone can have brown. So the most easiest way to understand genes and alleles is that the gene is going to be your eye color that you are certainly going to have, but what kind of eye color, that's going to be determined by your alleles. In the same manner, your MHC is going to be your gene, but the type of MHC that you are going to get, right, the type of HLA that you are going to get, that is going to be your allele. That's going to determine it, right? And a lot of us have different HLA alleles. So it's important to note that there are certain kinds of these HLA alleles that have an association with an increased risk of developing a certain kind of disease. But then again, it only increases the risk. It does not guarantee the disease. And this is one of the reasons why HLA typing is not diagnostic for most autoimmune diseases. And by the way, all of the diseases that we're going to talk about today are going to be autoimmune, right? So why do I say that HLA typing is not diagnostic? The reason being because let's just say that someone has HLA B5, right? And in studies, it has been shown that HLA B5 has been associated with disease X, right? And they show specific symptoms of it. So a patient with disease X comes to you and they say that, oh, I'm having these symptoms, and you start to think, okay, so this patient might just have disease X. And you say, to confirm my diagnosis, I'm going to do an HLA typing. This is wrong. You never do an HLA typing to confirm the diagnosis, right? Like I said, if you have the kind of HLA, it increases the risk of having disease X. It does not guarantee that you have disease X. Okay, this was just an easy way to explain this. So these disease associations may occur due to mechanisms such as molecular mimicry, protein misfolding, and aberrant T cell activation. But for now, the most important thing to remember is the association themselves. Okay, on this slide, there are numerous diseases, and let me just tell you that each of these diseases is very, very, very high yield, and you have to know them from head to toe. Autoimmune diseases and immunodeficiencies, these are one of the most favorite areas of USMLE that they love to test, and I just want you to know them from head to toe. Now obviously I cannot talk about all of these diseases, it will take a lot of time. I will discuss them in their own respective lectures, but I'm just going to give you a very, very brief intro to them at the least. Okay, so first of all is going to be HLA-B27. So out of all of these over here, the most important one is going to be HLA-B27, and I want you to know about this the most. So it is associated with seronegative spondyloarthropathies. Seronegative means that the diseases lack rheumatoid factor. If I'm going to make this very easy, rheumatoid factor is going to be your IgM antibody. Okay, so IgM is, by the way, a pentamer. So I'll try my best. So IgM is a pentamer. So it's going to be an IgM antibody attached to the Fc portion of an IgG. Right, so this is the Fc portion of IgG. I'm going to discuss antibodies in their own lecture, but this is what is known as rheumatoid factor. So those diseases that lack the rheumatoid factor are going to be your seronegative spondyloarthropathies. Now, which diseases are they? They are known by the mnemonic pair. P is going to be psoriatic arthritis, right? So psoriatic arthritis. This is going to be like psoriasis. Psoriasis is basically scaly and itchy surface on the extensor areas, right? So it's going to be like you're on your elbows and other extensor surfaces. Plus, you will also see what is known as nail pitting, right? So nail pitting. Okay, next A is going to be ankylosing spondylitis, right? I'm just going to write AS. Ankylosing spondylitis is when in the lumbar region of your spine, there's fusion of your vertebra, right? So your vertebra get fused together, and that leads to a very characteristic X-ray that is known as bamboo spine. Literally, if you just look up this image, you will literally see, and it looks like a bamboo, right? How do you know how your bamboo sticks look like? So this is what the bamboo spine X-ray looks like, and it's kind of like a very high yield buzzword, so it's important that you know it. And plus, since their spine is affected, so they have problem with their breathing also, right? And then next we have IBD associated arthritis. That's going to be your eye. So IBD associated arthritis, that's going to be arthritis that occurs with inflammatory bowel diseases such as, and these are going to be very important later on, like Crohn's and ulcerative colitis, right? So it's going to be pain in the joint associated with inflammatory bowel diseases, either Crohn's or UC. Right? And then you have what is known as reactive arthritis. R is for reactive arthritis. Reactive arthritis is going to be, it's remembered by a mnemonic that is known as can't see, can't pee, can't climb a tree. And I think you have heard this a million times, but this is a very famous mnemonic for it. So can't see, this is going to be conjunctivitis, can't pee is going to be urethritis, and can't climb a tree is going to be arthritis. So this is basically a triad of symptoms. So conjunctivitis will present with like visual problems, right? Can't pee or urethritis is going to present with pain with urination, and can't climb a tree obviously with pain in the joints. The important point about reactive arthritis is that it is most commonly associated also with certain microbes, right? With certain bugs. And the most important ones are going to be chlamydia, right? So chlamydia, Campylobacter, Shigella, right? Shigella, Salmonella, Yersinia. So these are a lot of them, but the one, if I just had to tell you, just remember one, that's going to be chlamydia, right? And maybe even Campylobacter, because these are very highly associated with them. I'm not going to deep dive into all of them, but these diseases are very important, right? In terms of the lecture, in terms of the topic of the lecture, HLA B27 along with these pair diseases, these are very important, right? The rest of them, I'm just going to take their names. So HLA-DR2 is associated with multiple sclerosis, SLE, good pasture, and hay fever. HLA-DR3 with type 1 diabetes, Graves' disease, again SLE, and Hashimoto. HLA-DR4, rheumatoid arthritis, type 1 diabetes, Addison's disease. HLA-DR5 is associated with pernicious anemia and Hashimoto. Now, if I go through all of these diseases, I swear to you, it will be more than 1 hour. But I'm just going to keep it short in the context of the lecture. So yeah, that's it for today. But like I said before, you're supposed to know that certain HLA alleles carry an increased risk of developing a certain kind of autoimmune disease. And this is a small list of them, with HLA B27 being the most important one. And along with that, you're supposed to know that if you have a patient with a certain kind of, let's say they have psoriatic arthritis, and you're suspecting that, okay, this patient has psoriatic arthritis, so just to confirm my diagnosis, I'm going to do an HLA B27 positivity test. No, you do not. You never do HLA typing. Sorry, you never do HLA typing for confirming your diagnosis, right? And one another thing that I just remembered, you see these diseases, this pair constellation, it is very important for you to know that This, let's say that a patient has ankylosing spondylitis, and in the question they give you a very vague kind of answer choices that you're thinking, wait, these are not related to anyone. Just know that they are trying to see whether you remember that ankylosing spondylitis is a part of this constellation of symptoms, sorry, this constellation of syndromes. So just giving you an example, if a patient comes up with ankylosing spondylitis and then they tell you that and then they tell you that what else would we see, just remember that it is going to be one of these. So they can say psoriasis on your extensor surfaces, right? Or IBD associated, like they can say that the patient can have Crohn's disease, UC, right? My point is that you are supposed to know that all four of them are associated with each other. So if you have one, most probably the question is going to test whether do you know the others and do you know the association with others. That's all I want you to know, right? It might take some practice, but this is going to be very important.